Welcome everyone to our behavioral health series. This will be the last session in the series focusing on youth behavioral health. My name is Monica Dreyer-Rossi and I am the program manager for the Indigenous Behavioral Health series. This 4-session series have focused on youth behavioral health, developmental and clinical considerations. And today we will open up for reflections upon important youth behavioral health topics and take questions from you guys at the end of the session. So we are located at the University of Iowa, but we're also a part of a national networking center. And today the presentation will be given to you by the National American Indian and Alaska Native PTTC and ATTC. I want to thank our students, Sarah Adams and Taylor Magnuson, for helping us with this session, and to our director, Dr. Anna-Helena Skinstad. Could we have the next slide, please? This program is funded by SAMHSA, but the content and opinions expressed during the session today do not necessarily reflect the views and policies of our funder. Next slide, please. We would really appreciate it if you could give us if you could evaluate the program at the end of the presentation. We will put a link to the evaluation in the chat, but we will also send a follow-up email after the event, so you will get another opportunity to give us your feedback. In that email, you will also find instructions about how you can receive certificates of attendance from us. Next slide, please. So I'm going to hand it over to our presenters today. We have Ken Winters, Nelda Husky, Dr. Jackie Gray, and Dr. Kathy Tomlin here with us. Welcome to all of our presenters.
Monica, thank you. I'll just kick it off by saying hello to everyone. Thank you for your attendance. I hope you all enjoyed the holidays. It perhaps is something you all are aware of, that for those that have served our country, the highest participation rate among ethnic groups comes from American Indian Alaska Natives. I've been working with the center for several years. I am also a researcher with the Oregon Research Institute. Have enjoyed my time helping with this seminar series as well as others. And today I'll be somewhat co-hosting and moving us along as we spend time discussing and sharing. Over to Kathy.
Hello, everybody. I'm Kathy Tomlin from Portland, Oregon. Welcome. It's always nice to hear and see you. I am semi-retired now, having worked in healthcare for a long, long time. And my family is from Cheyenne River, and my mother's side and my father's side were from County Mayo in Ireland. And so I'm glad to be here and glad to talk with you and share with you. So thank you for being here. Jackie.
Well, see you. Greetings, everyone. It's great to be with you again. And I'm Jackie Gray. I'm a Choctaw Cherokee descendant and co-interim director of the National American Indian Alaska Native PTTC. And I'm looking forward to our session today. And I'll pass it on to Nelda.
Good morning, and thank you for your attendance today. I'm looking forward to today's session and the interactions that's going to be taking place. I work in Tuba City in the mental health department. Welcome. Go ahead, Ken.
Kathy or Jackie, would you like to?
Go ahead,
We'd
Jackie.
like,
Go ahead, Jackie.
we'd like to start off with the land acknowledgement and to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken over and inhabited. Past and present, we want to honor the land itself and the people who have stewarded it throughout the generations. This calls us to commit to forever learn how to be better stewards of the lands through action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native American territories, and we respect the many diverse indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against indigenous people on Turtle Island, today we say thank you to those that stand with indigenous peoples and acknowledge that land reparations must be made to allow healing for our indigenous peoples and to Mother Earth herself. And this was written by Ella Keeley Driscoll and Sean Bear from the Winnebago and Meskwaki nations. So thank you.
Thank you, Jackie and others. It's a pleasure to have our faculty joining us. As noted earlier, this is a chance to share and discuss, ask questions, seek input from all of us. So we hope you feel quite free to use the chat box or raise your hand and contribute to today's session. The prior sessions dealt with some background material related to adolescent development and various factors related to how teens develop, both in a very healthy direction, but those that may fall victim to some disorders. And then 2 weeks ago, we looked at clinical issues and talked about some treatment cases. So today we're going to reflect on some of those themes and have you weigh in on some of your experiences when working with young people. Next. Briefly, the topics we've covered in the prior sessions, all the way from discussing teen brain development and the importance of that biology and the interaction with experiences on development, and then focused on several factors that impact on how we view adolescence, how adolescents experience it, and how we might prevent or treat behavioral disorders. And those themes included the role of trauma, the importance of protective factors, the key influence of culture, and the need to make sure our prevention and treatment programs are culturally informed. And then throughout, we talked about the importance of community, the identity and connection to Native community, and then those important spheres of influence in young people's lives, all the way from family and relatives to the larger community and their connection to spirituality. Next. I'm borrowing a slide that Kathy prepared sometime back that was a chance to give a quick summary of these sessions. So a little bit more detail. Adolescent brain development was discussed and how that has a biological component to it, but it just really impacts so much of the psychological well-being of young people. And adolescence is a major period of brain development. And so it's quite vital that what is important for healthy brain development that we think about when someone is prenatally living or is a small child, we also need to extend those principles into adolescence. Kathy did a great job of coming up with 4 terms, all with the letter C: connections, community, culture, and caring. These four themes are the springboard for assets and for resilience. And when, as helping professionals, we keep those principles in mind, we likely can promote doing a good job in our prevention and treatment efforts. Youth need family and the larger communities to stay safe and develop in a healthy way. And yet when kids are troubled, acknowledging it, offering support in a non-judgmental and caring way is very important. And Kathy included the term playful. I'm glad she included that. It's a great point. You know, successful services for young people, you know, they need to be relevant. They need to be meaningful. They have to be practical, but it also helps for those services to have some kind of fun component to it. So even, you know, treatment, which might be one-on-one counseling, and you're dealing with, you know, some pretty serious, significant issues. There are ways to infuse some kind of fun and entertaining activities. So it can improve engagement, and when engagement's improved, likely you're promoting outcome. And then hopefully with all of the presentations, we talked about the importance of connecting to culture. And we'll do more of that later today when we want to engage you all on how you are trying to make sure your services are culturally informed. Next. I thought this quote from Laura Knapp was quite insightful. I've heard from youth that have parents from other countries or cultures say that they are often torn about their own cultural identity. I tell them, you don't have to choose between them. You can embrace them both and create your own culture for yourself. Take a little bit from American culture and keep the roots of your original culture. Both is possible. I thought there was some great insights there. Sort of the blending concept, and blend to the extent you want to and in the ways you want to. I wondered if anyone wanted to comment on Laura's interesting and insightful quote, either in the chat box or raise your hand and unmute. It's a chance for people right off the bat here early on to weigh in. Hopefully you have kind of a thumbs up.
I'll add to your comment. I work out of Hickory, North Carolina. I got my master's in social work, and I work with an adolescent program, juvenile justice. So a lot of times my kids come from, you know, the court systems, and I see mostly a lot of African-American, Latinx, and white or Caucasian. Never see a lot of Native Americans. So, and I used to substitute teach in Guilford County when I was a grad student. And I remember my kids would say, you're not white, you're not black, what are you? And, you know, I'd say Native American, and sometimes I would say like Pocahontas. So helping people understand my culture as a whole, I'm Lumbee tribe out of North Carolina. That has been always kind of a challenge for me to help people understand, because a lot of people don't educate themselves about Native American culture in general. And specifically when you live as a Native American, and you know, you're right, you have your own cultures, like your own identity that you identify with, like in your homeland, but also stepping out of where I grew up and exposing myself to other cultures. I'm very aware of how other people think, but sometimes I have a hard time getting out of my own box, because I'm like, I don't ever see a lot of Native American people, or that imposter syndrome can kick in, where not to say I don't feel accepted, but sometimes it's difficult not seeing a lot of other Native American people in my circle as a whole. That makes sense. So
Yes,
I was happy to be a part of this training today.
Thank you. Thank you for your insights. Hopefully you're learning from clients that are Native, and they can teach you, even though you don't see them frequently, as you know.
And that's the thing, like when I go back home, the UNC Chapel Hill has the Indian Circle, and I have a lot of friends in that, and we have a culture center. So I do see the practice as Native American culture, around me. But as far as like putting it in different aspects, like maybe Charlotte area or more predominant cities, I would like to see more Native American awareness, or even people being able to promote the practice more into bigger cities. And I'm seeing it, but I'm always grateful that people, allocate time or turn their focus to learning about our culture, because it's a beautiful thing to see that.
Thank you. Wise words, Allison.
I
Savannah.
think we've got a couple of comments in the chat.
Yeah, Jackie, you want to read one of them that you like?
Okay, Mary Noel says, I think Native youth can be torn between their Native culture and community and the dominant culture influenced by the peers in their schools and online. And Savannah Morin says it's easier said than done, but bringing awareness that an individual can coexist is the best way to start authenticity. And I feel some people face shame, both externally and internally. And she goes on to say Native youth and young adults living off the reservations are more exposed to dominant culture, especially in school environments and social media.
A good point about the differences. Reservation-based or non-reservation-based living, and the influences are going to weigh themselves in differently, aren't they? Bringing awareness that an individual can coexist. It's a great start. It's like therapy. You try to raise someone's awareness at the front end of therapy that maybe their health habits aren't so good, or that they raise awareness that maybe there's an opportunity for change, even though you don't yet get into what the specifics are. But
Mr. Ken, I wanted to add one thing to Miss Jacqueline Gray? So I was just wanted to say, I have like a farm area like on the side of my work, and we have like peacocks, goats, all kind of animals. And then we have like a pond water. And all my life I've felt spiritually connected to water, or even like it rains. So there's things about me being Native American and like that spiritual aspect that I feel like I tap into. So make a long story short, when I work with my kids, that to me helps me incorporate my culture, is when I can take them outside and we go, we have fishing poles, so we fish before. They'll pet the animals, but just that nature therapy, I like to call it, it's really helpful. Or even taking them outside of, asking them questions or trauma related, like using those psychotherapy models. Sometimes stepping outside of all those questions and things and just, enjoying nature, like the simple things or even things I've learned from my culture, that makes me feel good, just like practicing instead of just kind of like talking, like we talk about culture, but actually like putting it into work of therapy. I find that to be a way to promote culture as well, that I think other clinicians could use as far as work as well.
I know there's a lot more written these days about, I'm going to call it experiential therapy. Hopefully I'm characterizing this properly and reflecting what you mentioned, Allison, that there's evidence for it. And so people stretching their comfort level and using that model, I think is a great thing. And maybe we'll see more of it. I know if it gets taught in the training programs, then usually it gets founded and will find its way into practice. And so that shift would be welcomed. I think all of us see that. There you go, Jackie. Right, milieu. Did I pronounce that right? Milieu therapy. Yeah. Back in the day, Jackie, milieu therapy was traditionally just, okay, you got a little bit of group, a little bit of individual, and you had rec therapy with inside a room and you painted. Not too experiential. Try that again, Jackie.
So it was outside.
You broke up a little bit there, Jackie. Do you want to try it again?
I said,
There you
maybe
go.
in your day it was within the building, but
Yeah.
sometimes it included those that were outside the building as well.
Right. That was, yeah, there's the narrow version and the broader version, right? We did, Mary says, we did ropes courses, hiking, solo survivor experiences, and other initiatives. That's excellent.
You know, I think that all of that really ties to just being a teenager and what do teens need in care. And so a lot of that is really tying it back to developmental theory in terms of helping helping young people be exposed to a lot of different things, so that when the pruning process in the brain happens, they have choices. I do want to comment on something Mary said, though, earlier. That notion of feeling ashamed of being Indian, especially if you're closer to dominant culture or you're in a school system that where there might be some bullying going on because you're Native, and the need to belong as an adolescent, and feeling torn about that as a Native person. I think that's an important thing. It's an important thing that Mary said, that a lot of the closer you are to dominant culture, the more influence it has. And if you're not involved with your culture, your community, that influence can be very confusing for Native youth. And then I was just talking to one of the young women in one of the tribes I visited here in Oregon, and she mentioned that. She said she felt bullied and she didn't belong, and she didn't know how to handle that. So I think what Mary's talking about is really important to highlight when it comes to the unique experiences of Native youth in dominant culture settings or institutions.
Yeah, directly addressing that uncomfortableness, the shame or the despair you have is important. It's not ideal, is it, to decide I'm going to endorse another culture because I'm feeling shame with my own culture. If you want to blend because you love what you like in your culture, and maybe find something in another culture that fits with that. Not as a replacement. Mary notes it also true for other cultures such as Asian Pacific Islanders. Yes.
Might stretch it to say any person of difference.
Yeah. Doesn't even have to be race.
No, however, youth of color are targeted often. Yeah, so anyway, I'm just thinking of my mother because she experienced that. And a lot of Native children will deny their culture and try to live a life that isn't authentic to them. And once they embrace their culture and learn how to live in two worlds, travel both worlds, you can spend a whole lifetime feeling disaffiliated.
Right. Well, it's a part of your identity, one's culture, and when you don't feel connected, you feel like you're not as whole a person as you could be. Excellent discussion, Sarah. We can continue the momentum of what it's like to be a teen if we go to what I think is the survey results from, actually, let's do a flip-flop. Go to the next one. Okay, group, some of you were around for the first session where we did a poll, and you were asked to weigh in with which were significant memories you had of your youth. And I listed these alphabetically. And then here is the poll results. We didn't have much time to talk about it, I don't think, during that session, but I wanted to highlight there were 3 that sort of had the highest ratings. That is, those that mark them as significant memories. So almost 50% gave emotional roller coaster as a significant memory. Having fun, 40%, and almost 40% socially challenging. As Sarah says, we had 105 respondents. So, I mean, I look at both, I look at this as kind of an interesting picture of adolescence, and maybe not too surprising. I'm just curious how people want to weigh in as they look at these numbers. There's one that's really low, forgettable. Great, that's low. That might be a pretty good sign. But only 12% thought it was rewarding. Any thoughts on how you all viewed adolescence?
Ken, I think most of the people that I talked to, would you like to repeat your sentence? No way. There's just so much going on at the time. I said when I talk with people that have been just about, would they like to repeat their adolescence or be an adolescent again or anything like that, there's no way that they want to do that because there's just so much going on during that time.
Not wanting to return to it. Yeah, a common theme. If you study adolescent development, it makes sense that a lot of people said it was an emotional roller coaster and socially challenging. Other comments or thoughts? People, anything really strike you as surprising?
Mr. Ken, I was just gonna say it was surprising for the supportive community, 13%. So I'm just assuming how many people, what type of support people really did have, or could some of that be maybe like single parenting home or
Yeah.
if you lived on native lands or if you didn't, because I know I didn't live on a reservation. I mean, I lived in a predominantly Native American community growing up, and I would say I have more support in that community than I would have like staying how I do now, like raising my child now. He doesn't have that strong, I'll be honest, I have a 2-year-old, and he doesn't have that village of support I have just due to me not staying near my family. But I will say having more influences as grandparents and aunts and uncles seems to make a childhood more like trusting and like that foundational part that I'm glad I had.
Yes, Allison's point about quite low, the supportive community number. It's an important asset to have support in the community and have a loving home. So we have 2 relatively low numbers there. Number 4 isn't all that high, 29%, and number 8 is quite low. That meant, calling upon one's youth resilience, as you might, perhaps don't get your environment to offer enough care and support. And Savannah's got a great point. Yeah. Home and community, to the extent they are supportive or not, can impact many of these other characteristics here. Well, it's not a scientific poll, is it? But kind of reflection of some of us and our thoughts, or at least our memory of our thoughts. And of course, as one ages, you might see adolescence quite different. I'm wondering as you you know, my read of adolescence when I was, let's say, 25 versus 55, that might vary quite a bit. I don't know if time makes it seem like it was a more favorable experience, or maybe the other direction. Not sure. And Kathy's reminded us of those key assets. As we noted earlier, and through our sessions, we've tried to make a strong link between the importance of those kind of rewarding, supportive spheres of influence that are so important for normal adolescent development, and are important for how you can try to steer more support when you're dealing with a teenager in counseling. Well, Sarah, let's go backwards in the slide deck, and it's a chance to do a poll. So Sarah, people are going to get a chance with a insert. Here we go. So here's the idea. We are going to have more in our series on native behavioral health, and we've listed 7 possible additional topics that we have put on a provisional list, and we would love to know which ones you like. You can vote for as many as you want, and this might guide us as we think through how we're going to proceed. We anticipate the next series, whatever the topic is, will be sometime late this summer, but we like to have a new series every few months. So at some point we might run through all of these. We'll give you a little bit of time here. Thanks, Laura. You can thank the team at the center for this list.
Mr. Ken, how long does this meeting last today?
Oh, well, it lasts as up formally till 12:30 Central Time, but we know a lot of people have to leave the top of the hour, and so we welcome as much time as you can be with us.
So, Mr. Ken, I kind of found out about this conference through another conference I had attended, and just a quick update, because I see y'all's have like 3 other meetings and then this one, and I'm just now getting on this one. Y'all represent SAMHSA, but y'all work with Native American specifically groups, or can you just tell me like what you do?
Yeah, right. Our center focuses on American Indian Alaska Natives and behavioral health. And we have 3 branches, one addiction, one mental health, and one prevention. In our workshop series spans all 3 of those themes. And we always pick a topic that we think is relevant to service providers. In many ways, it's those that are in the counseling arena, but also for prevention specialists and for program developers and policymakers. But yes, our focus is on American Indian Alaska Natives, funded through SAMHSA as part of their large technology transfer center network.
Okay, thank you.
Hopefully that helps. Sarah, what was that poll results again? Looked like family won the horse race. Look at that. interesting, but everyone liked some of them to some degree. And as Brian noted, we might be bundling some of them together. But we'll take this and use this to inform our next steps. We appreciate your input there. Sarah, why don't we go 2 slides forward? Excellent. Quickly, I'm just going to review a few health themes that we briefly addressed earlier, but also reflect some new information that has emerged, at least in the popular media and to some degree the literature in the last few weeks. Just wanted to remind folks that we talked about sleep and how that is a problem. Sleep deprivation is a problem for young people as they're growing up. These are national data that were collected in 2018. It's not specific to American Indian Alaska Native youth, but the numbers are not encouraging. If you look at the bars, you can see that the numbers percent of young people that say they're getting 8 or more hours of sleep a night on average, it drops as young people are getting older in those teen years. So even the best years, 9th grade, it's only roughly a third. And look at how bad it is in some ways for 12th graders, under 20%. So sleep deprivation is not good for one's health. Can you catch up on weekends and sleep in 12 hours, for example? I tell parents, don't be too upset if your teen's sleeping in on Saturdays and Sundays, because there is some suggestion that catch-up sleep is helpful when the rest of the week the teen is being deprived of a good night's sleep. And it's interesting how sleep is related to all kinds of behavioral health issues. And some of you may realize that some school systems are trying to address this by having later starts in the morning, but there are challenges for that. Okay, next. A little bit on social media and digital age that we live in. A study I found, done national survey of over 1,000 youth, that compared 2012 to 2018, was printed by a group called Statista. I could not find more relevant, comparable data that brought us to more closer to 2023. So we're going to have to live with these two comparisons of 2012 to 2018. They do tell one big story. In that 6-year span, use by teens on social media increased drastically. Just look at more than once a day respondents, and that was 70%. And then among the 70%, look at this, 16% almost constantly among the 70, about a quarter of the 70 hourly. Obviously, that's a lot. Way down here, you get a very small percent that don't use it at all. And you can see that the orange bars are higher for the frequent use and lower for the less frequent use. I assume if we had 2023 data or 2022 data, the orange bar here would be higher and orange bar here would be lower. So not a news bulletin. Use of social media, it's probably been increased by all of us across all age groups. But what is its impact on young people? Maybe you saw the warning by this U.S. Surgeon General this past week about the mental health crisis of young people. And there was a big link to overuse of social media contributing to it. Go to the next slide, Sarah, and there's just some numbers. This comes from a 2018 survey, national sample, representative, almost 41,000 young people. And they looked at young people and the extent of screen time. So that's not just social media, but most of it likely was. And then all kinds of behavioral health indices. And you can see in the wrong direction. So the more screen time, and there they just drew the line of 1 or more hours a day, less psychological well-being, less self-control, and less emotional stability, greater difficulty in finishing tasks, and greater difficulty making friends. The good news, if you were a low user or a non-user, but a low user, you were generally as healthy and had the same wellness type measures as the non-user. So it does speak to the value of being realistic with young people and perhaps not having them abstain from social media, but just reducing their use of it. And of course, there's what they use it for and being strategic with its use. Next slide, and then I'm going to pose a question to the group. So let's show you this a brief video of this documentary. So a film was created called Screenagers Movie. It's a film that delves into how tech revolution has reshaped adolescence and its effect on substance use. It spends some time debunking myths and depicts strategies parents in school can use to encourage healthy decision-making, supporting teen mental health, setting limits, and creating healthy home environments. So with Sarah's help, we're going to show you a brief 2-minute review of this full movie that you can access with that website. So give it a shot, Sarah.
There is no question that our tech revolution has completely shifted our world. Talking with teenagers in my clinic, I've had growing concerns about the impact of media on teens' thoughts and decisions when it comes to substances like nicotine, alcohol, weed, and other drugs.
I started vaping about 1 year ago.
90% of smokers start before the age of 18.
One vape, it's like 20 cigarettes.
Vaping created anxiety that I didn't have before.
If you ask the question, when is the right time to drink alcohol? When you're happy, you should drink alcohol. When you're sad, you should drink alcohol. That's the world that kids are living in.
Instagram was terrible for my mental health. I compared myself to others. I started hanging out with a lot of kids who were 18 years old. I'm 15. With alcohol, they're gonna make me cool.
I felt like, a terrible mother because I do this work for a living and I have a child who's running off the rails.
I really wanted that feeling of winning, the excitement from getting that.
Your grades are falling drastically.
Behaviors like video games, gambling, social media, that natural history is identical to the natural history of addiction to drugs and alcohol.
I'm going to protect you by smashing it with a hammer.
People will literally just post them smoking a joint.
I thought marijuana is legalized as medicine, so I'm just taking it into my own hands.
I was always trying to fix things for Joe.
Cortical thinning in teens who have used cannabis, it has a lot of concern. People have linked cortical thinning to psychiatric disorders like depression.
Drug dealing has gone onto social media apps.
My son thought that he was taking an oxycodone pill, but what he was really taking was a fake pill made of fentanyl and binder.
That's part of a social media protest. The parents say the Snapchat is not doing enough against drug dealers.
I'm trying to promote this message that they don't have to engage in any substance abuse or use to be themselves.
All sorts of parents are afraid of having consequences. She has the right to her negative emotions.
This was my very last vape. I just pulled my phone out. I said, this is day one.
Teens want to be loved by being listened to.
We have to empower kids to make their own best choices.
Thanks, Sarah. Obviously, this focused a lot on the influence of social media on substance use, but you can imagine how if you could flip the script and talk about the role of social media on just general mental health, emotion regulation, depression, anxiety, you could see how, in many ways, overindulgence in this resource really can lead kids down a real negative emotional path. So, Sarah, go to the next slide, please. And just one more on this select topics segment for today. Recently, the CDC released some data that was somewhat distressing. Nearly 3 in 5, almost 50% of teen girls reported that they felt persistently sad or hopeless in 2021. Now that includes COVID year. So that surely could have somewhat of a COVID effect, but it's double that of boys, and it represented nearly a 60% increase in the highest level reported over the past decade with respect to girls. So all the teens did report increasing mental health challenges, and anyone who studied COVID effect is reporting that. But girls fared much worse than boys across nearly all measures. And the new report also confirmed ongoing and extreme distress among teens who identify as lesbian, gay, bisexual, or questioning. So I've sort of intersected two themes here: social media and teens' emotional health and well-being. A question for the group, please feel free to use the chat or raise your hand. How are you, if at all, addressing this with teens when you're working with them in a clinical or counseling setting? Are you directly addressing screen time? Are you assessing it? Are you considering that whole phenomenon when you're looking at a teen's emotional health? I want to open it up for some general discussion. I'll even throw in this. Has anyone talked to parents of a teen you're treating about how they can help manage screen time, or they have a role in managing screen time and may need to increase that role? Rebecca's weighing in. I do directly, oops, I gotta go backwards. Jackie, I'll have you read one of them after I read Rebecca's. I do directly address it in session, the impact of self-image as well as how it impacts sleep, which in turn impacts mood and all of the above. Rebecca has looked at the full intersection, and as she notes, she directly addresses it. I think that's excellent. It's got to be a contemporary topic these days for almost any behavioral issue that you're presented with.
And Nicole says that, yes, I've talked with parents. We talk about limiting it at night and turning off Wi-Fi or having limits on their phone. Being able to review what sites their children are looking at.
Savannah says the challenge I give clients 50 to 60 minutes, how often they're wanting to look or grab their phones, and it opens up something to explore. Yep. You're using it as an assessment tool. That's excellent. And then of course you get to use that as a lessons learned. I don't know if people have had any experience with websites that help parents learn what are useful screening tools to put on a phone to help prevent some negative material, adult material to even be accessed. There are efforts out there. I don't know how effective they are. I know there's a market for them.
Share some of those.
It could be also, let's think about it from a generational perspective as well. Earlier, young adults used technology differently than the generation that just followed them, than the generation that followed them, based on the technology advances. So I remember asking a bunch of young people what they did with their phones. And they said, oh, I said, do you spend all your time texting to your friends, or do you actually talk to them in person? Yeah. that was generation, the early generation. And they all said, oh no, we're just using it to connect with each other, but we don't just talk on our phones. Now, fast forward it to today, where if you ask the same question, with the current generation, you might get a very different answer. So it's like constantly changing, which means that adults need to catch up to the constant changes just to stay on top of it.
Well, Kathy, your point reminds me of, there's likely a lot of instances where parent doesn't know that a friend that their teen is communicating with is someone they've never met, don't even live nearby.
Yeah.
Jackie, and Kathy and Nelda, there's some great responses. Anyone want to hone in on?
Well,
I know Patricia's focusing on the importance of teaching parents about how they can be a sort of an intervention agent with this topic in the home, and how screen time has got its negatives.
Sometimes my sound is off and on, but did you hear my comment about what Tony said? We have our children being raised by social media.
Yes.
Yeah, that's
Right. Yeah. You mean the generation gap topic? Yes.
Well, it's the children on the reservation being raised by grandparents, and
oh yeah,
they're just doing the best that they can. Yeah, but once you separate by 2-3 generations with technology, wow, that really hit me. Like, yeah, a lot of kids are being raised via social media, which highlights the importance of having a caring adult be guiding that process.
And Mary said we used to discuss it in group, and kids weren't able to have their phones in treatment, and their craving to be online was treated as another addictive disorder. And that was in residential treatment.
Yeah.
I think the DSM, if you use that, actually had some preliminary data on internet addiction. I don't know if the next version is going to actually have a category called internet addiction.
Yeah. I think it's considered a provisional right now, but it's in the bullpen waiting for more data. But I suspect you're right. It'll.
Yeah. And Mary followed up saying that, that was their primary communication. So they really, in treatment, worked on interpersonal communication as part of their recovery.
Yeah.
Yeah. Well, I don't know how much people directly address this with teens, but one has to wonder what kind of social skills are not getting developed, important social skills, not getting developed because of too much communication with one's screen.
Yeah, Cam comments that she thinks any tool that blocks the websites or limits the screen time just make kids, teenagers, or anyone else just want it more.
Yeah. Yeah. You prohibit something, it elevates its significance.
I think it's good that you're bringing this up. Oh, can you guys hear me?
Yes, forge ahead.
Yeah, that you're bringing this topic up because no one really talks about it unless you're having a group or a session and you ask people to put their phones down or put their phones up, especially in like our traditional programming. Like we kind of ask people to put their phones down. We want them to listen and pay attention, what we're sharing. And sometimes we see it, it's coming from the parents or the adults too, using their technology as much or more than the youth or the kids. And so kind of like, but no one really talks about it. We joke around about it, but I think it's good to bring that topic and conversation up. It's important because the kids are learning from their friends and their parents or caretakers, whoever they're around, and I think sometimes they think you can give the kids an iPad or something like, here, go play. you know, and
Exactly.
you know, we try to tell our nieces and nephews and our family when we're doing things, activities, sweat lodge, we're talking, we're sharing stories. Everybody puts their phone down, turn it off, put it down. I want you to listen right now. And so to, you know, bring that into that conversation into the programming is probably good. You know, some people might get a little offended sometimes, but you know, but that's all right. I think that it's important, you know, to have that conversation.
You know, it can be insightful for a person who has a habit. They aren't really all that clear about the extent of the habit. Have them monitor a feature of that habit and then come away with a discussion about what that was like. So we sometimes do that with kids about substance use. Just have a monitor off and they're getting high in a given week. And then when they come back with the report, it can be an eye opener. It's something I tell parents, keep track and then discuss what you find when you're either the teen is keeping track or you're keeping track. And sometimes that can be a way to open the door to people realizing, hey, I gotta pull back here. I gotta rethink this.
Sarah says I like talking to the end about personal responsibility, and we talk about what that might look like beyond parents making rules they don't like. What seems reasonable to the teenager or the youth or healthy to them. And she finds that teens and kids are pretty insightful and are able to make reasonable limits when they're involved in making the choices.
Yes, good point.
As a mental health on-call staff worker, we take in at least like 7 to 8 calls of suicide-related reports over at our emergency room. And we get at least 1 or 2 adolescents, I would say about once a month, where parents are very fearful of setting limits when it comes to social media. They'll take kids will threaten suicide when their telephones are taken away or when their tablets are taken away. And those are the kids that we see because parents are trying to regain some sort of, I guess they're trying to limit their social media use, and the reaction that the kids get include emergency visits or require emergency visits and assessments for suicide. You know, so we do have parents who are very afraid to set limits. Just thought I'd throw that out there.
Nelda, how do you walk parents through that?
I think sometimes parents just need someone else to say to the child what it's like. You know, we have somebody who tells us something over and over and we just kind of ignore it, but then someone else comes in and says the same thing and we listen to that person, you know, that kind of same effect, you know, where they want to hear it from someone else, or you know, then they'll kind of think about it and it's just not their mom trying to create limits for them, or you know, not or their stepfather not wanting them or not liking them, you know. So that's helpful when parents are validated.
Yeah, that's a good point. Some great insights.
Kind of tied the brain, I don't know, but I wonder if people tied discussions about social media and the connection with the brain's development. I wonder if kids, because when I was doing treatment with kids, they they didn't want to listen to all the other stuff, but they loved the information on the brain because they wanted to know how the substances were affecting their brain. And I'm kind of wondering if a similar conversation would work with social media, you know, without the expectation that they're going to all of a sudden drop social media, but that they maybe might start monitoring it differently for themselves.
Yep, good point. I know our our research group talked about that sometime back, you know, how social media is very accommodating to teen brain development, or you could flip it. Teen brain development is very accommodating to what is offered with screen time and social media. It's almost as if there's a wonderful fit. It's like a key in a lock. Not that all humans, you know, don't have some of these obviously reward features that make us attracted to social media, but you could make, I think you could make a case that the way the teen brain is developing and its unique features that distinguish it from adult brain further promote or enable attraction to social media. And so you're right, Kathy. I think teens, if that was you, Kathy, teens learning this is helpful, and teaching parents this, I think, is helpful. Yeah. It gives you new insight. Yeah.
Yeah, I think sometimes older people who haven't grown up with social media, that the younger crowd will make them feel ashamed or bad that they don't know how to use the social media. And because that's the way that the world is going. And I think it would be an interesting conversation for older generations to talk to younger generations about these issues in terms of you know, social skill development, brain effects, substance. You know, I think that grandparents, older people can have a huge impact on younger people's thinking as it relates to, because you have to you have to tell the older generation will say, put your phone away. You know, I want to talk to you, put your phone away. And then there's an opportunity there to have that intergenerational conversation. In terms of, do you know how to have a conversation with me as a grandparent without using social media product? But anyway, I'm just reacting and responding to the conversation because I think this is a huge issue. It's very, very important issue.
The line you just gave has a generational tinge to it. Put your phone away. Now, current era for teens, they hate to hear that. Now, back when I was a teen, that wasn't ever an issue. It was time to come to dinner or clean your room. You know, the negatives that you rolled your eyes at, your parents were always saying, boy, put your phone away. That can create issues. Mary has noted, youth I've worked with over the years have also been interested in what we taught them about different impacts on their developing brain. Excellent. Mary, I hope you have found good resources for it. I think there's a lot out there. And it is, I think, useful insights for young people when they see how the adult world, the marketplace that the adult world tends to control, takes advantage of the teen's developmental situation. Some of it is teen brain related, some of it's hormones, some of it is other things. And it tries to attract them and maybe even get them addicted. So, you know, there's a school of thought that, you know, social media is trying to get kids addicted, and they're just using all the knowledge they have about what kids like and adding all kinds of features to cell phones and social media characteristics to further increase their attraction to it. So I bloviated there. Sorry, went on a rant. Other thoughts?
We're all in the older generation, but I thought, well, it's a good rant. It's something that we all, who care about younger people and their development and their health, I think it's up in the conversation.
Yeah. Well, many of us know that was one way that was helpful to attract teens to the idea that smoking was bad when the Know the Truth campaign came out, and the curtain was pulled back on how the cigarette industry, tobacco industry, were exploiting young people. And because they figured if we get the young ones addicted, obviously we got them addicted for life, blah, blah, blah. And, you know, they were getting tricked in some ways. And when that was disclosed, that that was a helpful trigger for young people to turn away from cigarettes. Of course, now they've kind of switched their habits, haven't they, to vaping. Sarah, could you go to what I think is the next slide, which is a chance to get the group to think, yeah, here we go. I was hoping we could get some sharing. I've got, it's a two-part question, but it really is kind of one thing. Hopefully you would be willing to share a memorable experience when you had nice success working with a young person, either as a prevention service provider or in treatment. So either in the chat or raise your hand. A time when you felt proud because you were able to succeed in helping a young person.
This is Mary. I'm trying to think of one of my favorites over the years. I guess my most recent one was just a few years ago, working at Yes House in Corvallis, and a young man and his mother came in looking for help, and she went into the office to do paperwork, and he was seated in the lobby area with his head down, you know, eyes to the floor, really curled up in his big coat. And I kneeled down on the ground in front of him and started communicating with him, you know, gently introduced myself, asked him his name. And then I just kind of explained to him the process of what was going to happen today, because he was there for an assessment. And he eventually got admitted into the program. And he became, and boy, his level of addiction to multiple substances that he had been getting online and shipped to different addresses in his area, in his neighborhood. I mean, this kid, it was just amazing the effort he was going to obtain his substances without anybody knowing. And a certain portion he would set aside to resell to other kids or other people, also online. I mean, he's had this massive network, you know, through his phone of connections, etc. And so he came into treatment, and over time, and it was residential, I think I might have mentioned that, you just saw him start holding his head up a little higher. His eyes looked brighter. He was one of the ones who said, you know, not even sure I still want a phone when I leave here, kind of thing. Tremendous improvement in his relationship with his mom. And then he successfully completed treatment as Yes House was closing their doors. And one of the things he shared in our final closing circle was he'll never forget the way that I connected with him that very first day he came into the building. And he said, if it had been anything different than that, he doesn't think he would have been as willing to come into treatment. And that just really moved me, you know, that meeting kids where they're at, you know, down at their level, volume of your voice, words that you choose, that very first initial engagement can really make a difference on the outcome of the kids we work with.
Mary, that's an excellent point about first impressions. How do you set up a counseling room when working with a young person? Are you thinking about, I got to set it up so it optimizes a nice environment, a nice connection?
For me, absolutely. I have artwork that's stuff they enjoy. I've got this, I've got silly marijuana signs. I've got toys. I've got stress balls. And then I've got all my native things, my dream catchers, my talking sticks. And just like in my groups, I always open them with a game of some sort. And they used to say, "You and your silly games, Miss Mary." But in the end, they really liked my silly little games, you know. But you know, similar to
Nice.
icebreakers, but you know,
Right.
it's something they remember and take with them when they leave. You know, I really miss it.
Thank
I
you
really
for
miss
sharing.
it. You bet.
Thank you. Excellent. Not only a good story, but some wonderful insights. Who else would like a chance to brag about your success with some? Maybe we have a shy group. Okay, pretend that you're talking about a counselor colleague that had success, and you're just going to refer to that colleague.
Laura's got her hand up. Oh, it's down now.
Share. I would say my biggest time of success was with a youth who was in a room upon where I was working. When I was in a meeting or doing something at the time that she needed support, but the rest of the team had tried to intervene and it didn't go very well, and they had her restrained. She was in the lobby of the facility, you know, just out where everybody sits and waits and stuff like that. And she was just being aggressive and violent and all those things. And of course, as soon as I was available, I went over to talk with her. And you know, they're like, "Well, do you want us to let her go? Like, release her from the street?" And I said, "Yeah, just, you know," and I said, "Come over here and just sit with me." You know, we just sat and we started looking at some yearbooks from the school and just looking at other things around the room and all that stuff. And eventually, just from not putting so much pressure on her or, you know, trying to force her into cooperation, eventually she gave up what she was trying to harm herself with. She was trying to actually swallow a rock, to try and harm herself. And so, you know, sometimes just like you said, just not putting so much pressure and, just be like a partner with them. That's what I try to do with the youth, is be their partner.
Be a partner.
I'm not another adult in your life to tell you what to do. I'm here solely for you. And I understand the concerns that the adults in your life have, which we'll address. We'll, of course, address the concerns the adults have. You know, that's important too. But what I care about the most is, what do you need? What is it that you need to feel safe and happy? You know, and I make it more focused on what their needs are first. And eventually, of course, we address the concerns of the adults, you know, in their lives, like their parents and those kinds of things. But I think if you start focusing on their needs first, and saying, "I'm here for you first," before, and not saying that the adults in their life aren't important, but just saying that this is my primary focus. Not that the adults are not important, but just that they need that support to know that they're the primary focus. And I think sometimes kids don't feel that way when they're first in treatment. And I think that's really what it was in that situation that encouraged her to cooperate. You know, they let her go, and eventually she gave me the rock. You know, she took it out of her mouth and she handed it to me, and we were able to de-escalate the situation and without any further incident. And she went on about her day and was able to calm down. And so I feel like that was a pretty successful moment for me, because so many people had tried so hard to help de-escalate her, and it didn't work to the point where they had to restrain her. But I was able to do it within probably 10 or 15 minutes, just because of the connection I created with her. Nice, that support, that unconditional support for her, and making her the primary person in the treatment process rather than the adults in her life. Yeah.
Excellent. Some important themes there, making sure the teen felt like they were the main interest of your efforts to be, as you say, a partner, and that you made sure you talked in ways that encouraged that partnership, that promoted a partnership, not a top down, not a therapist-centered, but more client-centered.
And I think if you are working with families, it's a dance because you also have to partner with the parents who, or caregivers who want you to fix their kid by agreeing with them. And it's a dance that I think you have to do in family therapy by communicating to parents and to the kid that you're neutral enough to be able to support them both.
It's a good way of putting it. The dance, the skill of a family therapist is vital. Yeah, you always have that challenge. A teen says something that is suggestive of a problem, of a health issue, of behavior pattern, and it's not something legally you have to report, but you realize, oh boy, is this something that the parents might need to know? Or if I was the parent, would I want to know this? Do I keep this a secret? Do I work with the teen on this issue? All those are part of the dance. Anna has a pretty good point. The removing of the lens of adultism is vastly important when working with kiddos. Anna, you want any elaboration on that? The lens of adultism. And I assume you were saying when a teen walks into the facility or into your office, you don't want them to think that they're looking through an adult lens.
Hello, I'm sorry. I'm actually speaking to ourselves as adults when we're working with kiddos. It's right, treating the kiddo as the expert of their world, right? Not making assumptions, really checking and being self-reflective on our own, preconceived notions on what this kiddo is experiencing, and really taking, really collaborating with them, right? And having and acknowledging the things that inform us, even as parents, and as thinking about when we were kiddos, right? What are things that we wanted to, or what are things that we needed when we were growing up, right? It's when we caught ourselves in situations that, and in different events that, caused us discomfort. What did we need in those moments? And allowing that to inform our interactions. But really, it's when you were with these kiddos, is they are the expert of their world, and really approaching therapy with curiosity and not in judgment.
Yes, that's good. You remind me, and I'm going to use Kathy's term, it's part of the dance of, you might have as a counselor in mind a particular advice you'd like to give the young person. And maybe it comes from evidence-based approaches. Or your own experience, and that it works with teens, but how do you impart that advice to a teen without looking like you're just doing it through an adult lens?
Yeah, correct. You speak their language, right? Which is at times very different than our own.
Exactly. And there's timing issues. There's, how it's described. I know motivational interviewing wants you to try to pull the answer from the client. Can you offer enough good strategic questioning so that the teen actually comes up with what you're striving for? All of those are, part of the skill, or being a good dancer. We just have a couple minutes left. In the chat box is a reminder of a link for an evaluation, a reminder that we're going to send out some materials that are follow-up. There are at least 2 things on my list, and we'll make sure we get them all, but some have asked for the adolescent brain development cartoon. It comes from U.S. News and World Report. we can send that because it's as long as you acknowledge its reference, and a better link for the Screenagers movie. I think the link looks like only provided the demo of the documentary. I got to find the link for the full film. And if it is a cost item, at least we'll put in that slide in the info for you. All right, what's the challenge in accessing it? I'm not sure it's a free documentary yet, so we'll have to do a little homework about that. Monica, any other thoughts?
Yeah, I just wanted to let everyone know to stay tuned for the next series in the Indigenous Behavioral Health Program. We will look at the results from the poll here and see which one we're going to provide next time around. You can receive information on our listserv, and please give us feedback. I also posted a link to another training that we are offering right now. It is the American Indian and Alaska Native Leadership Academy. The mentees from the program are presenting their on-the-ground projects while they were in the Leadership Academy. So please come back and see us on Monday at 1 o'clock if you're interested in those projects. And thank you all for coming today. I do see that Elena Herrera have her hand raised, so maybe she has a comment for us.
Good afternoon. Is it afternoon? Yes, it's afternoon. Good afternoon, everyone. My name is Elena Herrera, and I am with SAMHSA Native Connections. I've been working for behavioral health for 5 years now. I don't want to take up too much time, but I enjoy what everyone's saying on here. And I didn't think we were out of time so soon. I wanted to speak on about the social media, about all these great things that the topics were on today. But what I wanted to start with was in the beginning of my 5 years with 2020, it was, COVID time, and gathering all these teenagers. I have 25 teenagers right now, and I see all of them weekly, voluntarily. Right now, for the month of June, we have, there's so much to say, but so little. We run Monday meets. That's a teen support group every weekly, and I pick them up after school. We do hangouts, we do sports nights, we have officers. I have my president right behind me, and it's very heartfelt, loving when we talk to these teenagers. I heard somebody mention about the environment of the office. I work in the behavioral health, so my mission, my goal is to get our youth comfortable into the behavioral health. I just want them to walk in the door because of the stereotype that we have with mental wellness. I just want them to walk to the door and be comfortable. Then they come to my office and they're comfortable. We talk about who are our counselors. I talk about our counselors' traits, our counselors' funny little sayings, and get them comfortable, because my goal is to get them from my office into my counselor's office. A lot of our teenagers in our community suffer with drugs and alcohol, especially from their parents and their grandparents that's raising them. Grandparents are mom and dad now, and it's hard. And so when they're struggling with their young lives and that phone, I call the phone and cigarettes kind of the same. A lot of people are addicted to cigarettes. A lot of people are addicted to their phones, and that's okay. What we need to do is learn the root of it. So it's their coping. So when they come to my office weekly, they're never on their phones, and I never ask them to get off of their phones. I do have a phone bin, so if they want to put the phone in there just so that they know where it's at, they know where it is, but they're not forced to put it there. whenever they're home, we talk about, they say, well, I'm on my phone a lot. Okay, well, is there anything else you can do? No, I'm just bored. So you're on your phone because you're bored. All right, that's cool. What else could we substitute that with? Do you like painting? Do you like drawing? You want to play iMessage games with me? It's more, how would you say, understanding where they're coming from. I have so much to say and I'm so excited. I'm just overfilled with joy of what you all are doing here. And I just wanted to put a little bit of what we kind of do here, where just for our teenagers. And I really do have a big heart for our teenagers and our youth and our families. And I really appreciate what you are doing here. And we baha, that's all.
Where are you located at, Elena?
I'm located in White Eagle, Oklahoma, Ponca City, Oklahoma.
Okay. So you work with a Native American tribe there?
Yes, I work for the Ponca Tribe Native Connections here in White Eagle, Oklahoma, behavioral health. And what I failed to mention was in our weekly teen support group, we talk about important subjects. When they first come in, my lights went off. I'm about to buy another light. So this is my office. And that little door that you can see over here, that's a little closet area. I have a shelf that is a community pantry, has our counselors donate, people donate toiletries, food, just anything like that. Everything in that community pantry is free to them. They can come in and eat, especially when they're clients. I have a lot of my students that are clients. I call them my kids, but for this purpose, I'll call them students. When they come in for their session, a lot of their counselors know they'll probably be in here or they'll be in the lobby, but they all know they're welcome to come in, get a snack and walk out. I have a microwave, some food. We have these Ponca butts. That's like, it looks like Monopoly money. And so they can buy food with these Ponca butts. And this teaches them money management, life skills. And I'm not responsible for these Ponca butts. So if they get stolen or, things like that, that's what happens in life. You have to take care of your money. But how can I say, June 12th, I'm teaching, and this is all voluntarily. My supervisor, she does great work. Me, myself, I'm the youth coordinator. So I work really close with our youth. And so what I do is I observe what's going on between the whole group, what's going on within the community, and that's what we talk about. So in our peer support group, June 12th, for example, we're learning about fentanyl. That's a really big problem here and with our kids in this community. Fentanyl is going around with on top with marijuana, with pills, and a lot of my community youth participate in these drugs. What I say is, okay, you're doing these drugs. I can't say nothing, but what I can do is educate you on what this drug is, what it does to you, and how it can help, or how you can help someone else. Let's learn about, what is that called? Naloxone. It's for fentanyl. You squirt it in your nose for an overdose. I'm learning more about that, and I'm hopefully
You talking about Narcan?
Yes, I'm researching all I can right now, and my clinic has Narcan right here. And what I was gonna do is put some videos on. The videos only do so much. Teenagers, they learn more from me talking. So whenever I work, I lead by example. What I do, they watch me. It's kind of almost like when they come in my office, I don't see a 16-year-old, I don't see an 18-year-old, I don't see a 14-year-old. I see 8-year-olds, I see 5-year-olds, I see 6-year-olds. I don't see my teenagers. When they come in my office, they turn little and their inner child comes out. And so with what we all know is that children mirror adults. They mirror the ones that they look on. And so with me, I lead by example. What I do, I know that they're watching me. How I speak, they're listening to me. And so when how you say get on to them is actually communicating. And so when I communicate with them, instead of getting on to them, I notice that they start doing it to each other. I was in the van and I was driving, and I overheard, I don't usually listen, but I overheard one of them say, that's a form of gaslighting. And the other one said, really? And the one said, yeah, we learned about that last week. That's one of the signs for gaslighting. And they said, oh, I didn't know that, because what I did is I taught them phrases. This is a gaslighting phrase and what to say instead. Because a lot of people don't know that they accidentally gaslight others. It's just the phrases, it's just words. And so they listen, they're learning. And so, yes, we're learning about fentanyl and the importance of taking care of yourself when doing drugs, or when you're, because my thing is my job isn't to stop and preach you from doing drugs. My job is to educate you and love you and be there for you and teach you coping skills and teach you tools and how to help advance your life and advance your mind, and just really know why and about. And so we have a Hope and Recovery here, a rehab center. We just recently did a video with them, and they were talking to the video as if they were talking to my students of why they did drugs, why they stopped, and what happened, and just really went into detail for this video. And I thought, let's not stop it with my kids, let's share it to the whole community, because this is important. And so the reasoning why I said that is when they come in, it's more, they know that this is a safe place to practice how to use those tools. That's what I tell them. If you want to practice communication, that's okay. If you want to practice doing this, that's okay. You can practice in here. This is a safe space. What happens in Vegas stays in Vegas in this room. And it's really good. Do you want to say anything about our program?
A lot of, my name's Isabel Herrera. I'm the president of the Native Connections Advisory Council here in Ponca City, Oklahoma. I'm 16 years old. I'm actually one of the older ones in this group. Our youngest one, I believe, is 13 right now. And when we first all came in this group, we a lot of us, it was very like, we didn't talk to each other, we're all like, oh, who's this person over here? But going to these meetings and learning how to, like, I know a few people in this group who, when I joined, they had a bit of a problem with, vaping and weed and like drinking and other substance abuses. But once we all started going to this group, we started learning to love each other. We were all, we had our moments where like, I'm not sure about this person, but we learn to love each other, and we do, and we even hang out outside of this Monday meet now, and we're each other's like peer supports. Yeah, our support group.
Falls into the arena.
Yes, and not only that, but we learn about our culture here, of how we can connect to our culture with our mental health, and back to those kids, my friends who used to do substance, they have started to linger off it. I know of a few who even went to sweat, our ceremonial sweat, and enjoyed it, and are still practicing that way of life. And and
What's the name of the organization again?
It's the Ponca Tribal Native Connections Advisory Council.
Well,
That's
Can you type it? Can you type it in the chat, Elena?
Yeah.
Thank you. I'm
Yes,
just gonna look it up.
Yes, we are on Facebook, and these I have the Monday group is very separate to our NCAC. We are the Ponca Tribe Native Connections, and our youth are called NCAC. That's what they called themselves. What was that, about 2 years ago? And so they have a Facebook, Instagram, TikTok, and they have a lot of new ideas coming up.
I just want to say I'm Native American, and it makes me feel great to see the incentive y'all's taking with the children. And I can just tell from her doing the crafts and the room and just, your energy and spirit that y'all's making a difference. So thank you for both of y'all's work and, working with the kid. And like you said, you never know the impact just one individual as an adult that you're making in that teenager's life. So like I said, it really makes me feel good to see the work and the commitment that you have for your community. And I hope that, God continues to bless you and each kid, and even down to the food pantry. Sometimes you notice that when kids come and, that can show you a food insecurity in their home sometimes when some kids, need food more than others. So, just that service of even feeding them and giving them that safety net, it goes a long way. So thank you both.
Thank you for letting me speak. Oh, I'm sorry.
Thank you so much, Allison, for your comments. Thank you so much for Elena, for sharing with us about the important work you're doing. We really appreciate it. And I do see here that Jackie Gray posted the name of your organization in the chat here. So I think all of you should be able to find it from there. I really appreciate hearing about that. And we are 15 minutes over. Are any more comments or sharing before we say goodbye for today?
The program is called Ponca Tribe Native Connections. What the youth is called is Ponca Tribe or Native Connections Advisory Council, just to make that clear.
Thank you.
All right, thank you for your time.
Thank you to our speakers and to Kathy, Nelda, and Jackie today. And stay tuned for our next series and follow us on our listserv. Thanks all.